Here, I'm with Dr. Angelica Mastrodicasa.
Nice. Got the
Pretty
pronunciation
good.
down pat. Yeah, you did.
Are you fluent?
In Italian?
Yeah.
No, I wish.
Did you spend time in Italy? Did you take it in school?
I took it in school actually for 8 years.
So did I.
And boom, through one ear and out the other.
I have the same experience. You went to school in this area.
Yes.
I think there's not a lot of areas where Italian or secondary language was taught in addition to like how we would learn French.
Yeah,
there.
it was mandatory. You had to get a note to get out of it.
Yeah, well, that's so much for mandatory. It's mandatory. I have a note.
Yeah,
come back in an hour.
Yeah.
But I found, because I'm half Italian.
You are? Oh, okay.
My dad's from Friuli, the
Okay.
north of, like, near Venice. And their dialect is like a German Slavic slide into Italian, which is just where that region, those are the neighbors. Let's start talking like those people. So he would help me with my Italian homework, and it would be all wrong.
Oh, okay.
No, it would be bad.
No.
It was wrong. And I mean, talking to people now, dialects are sort of praised again, because for a long time, the dialects were deviating so much that people were getting turned off it, and the authentic Italian was being lost.
Yeah.
But then now they promoted it, and everyone had to speak that standardized, what's called Italian.
Yeah, in school and everything.
But now they're kind of reverting back to like embracing like the cultural differences and trying to be like authentic, like from your hometown.
Yeah, it's nice. They should do that.
Do you mind saying where your ancestry is from?
Yeah, I'm Abruzzese, and then I have some family from Rome as well.
Ah.
So a little mix, but I've only been to Italy once.
I've been twice. I was 2 when I first went, and then on my honeymoon,
Nice.
we went to Rome, which was great.
Touristy?
Not as bad. Venice was worse. Venice
Oh,
was ultimate touristy. Like, just get me out of here.
Yeah, but beautiful.
Yeah, there was beauty to it.
Okay.
I didn't realize there was literally no roads.
No.
It's just,
The roads are the boats.
I'm like,
in
can
the
I get a
water, yeah.
taxi? It's like, taxi.
A water taxi. That's the only one.
boat.
Yeah.
I'm like, okay, I'll take one of those.
Yeah. Nice.
Italian aside, let's talk about your practice and a area of health that you are passionate about, that being the skin and more particular acne.
Yes.
And before I throw you the ball to run with,
Okay.
acne has always been one of the harder things I've found to treat.
It is. I would say so.
So that means you're really, really smart.
I mean, really, really smart, or I guess I set the expectations, right, for patients to know that this is going to take a while to get better.
Okay.
And see whether they're willing to stick to the process or whether pharmaceuticals are a better option for them, because often they'll give faster results, and then there's things we can work on long term while they're on the medications.
I like that because
Yeah.
sometimes people are like, I need something right now. I'm my face is like having like it's a crisis, and I've seen it, and I like the idea of like working kind of like in the background as like, okay, there's a short-term solution here, but really this is allowing me time so that you have some peace, but we're fixing the underlying.
Yeah, because I think too with the prescriptions and the medications, a lot of the times once they go off of it, their acne comes back. So if we're working on the underlying cause while they're on the medication, then the hope is that when they get off of it eventually, their skin's not going to flare back up because we've worked on those hard things over time.
What are those things?
The hard things over time is probably the diet, the stress, the sleep, if sleep's an issue, even lifestyle factors in terms of like hygiene. Are you changing your pillow sheets? Are you using the same cloth to wash your hands as you are your face? Even things they're using topically on their face that they think's working, or their makeup that's making things worse. Like there's so many different factors.
So you mentioned like what would seem trivial, like changing my pillowcase or not using the same towel. But when it comes to acne, people who suffer with acne, it does seem like they are hypersensitive to these things that the average person will be like, well, I used the same pillowcase for like 3 weeks and I'm fine. Do you notice that?
Yeah, I do. And I think that it's often a lot of different factors combining together as one big issue.
Sure.
So I think it's important to at least try out the different little things and seeing if that's going to make a difference, especially when you've seen a patient who's tried 20 million things already or tried all these prescriptions. I think just education's the biggest piece. So, you know, these are the things we can do, and then it's up to them whether they want to try it and then see what's actually going to make a difference, you know, long term.
When you mention diet, what are the main things that a person needs to consider?
I think glycemic index and insulin and IGF-1 is a big conversation. So looking at, you know, avoiding the chocolate. There's studies that show that even a small amount of dark chocolate, like good quality dark chocolate, can still cause breakouts. There's conversations around dairy. It's not with everyone, but something to consider just because there's so much research on it. And a lot of people come in already telling me I break out when I have milk or when I have cheese. So there's that. But then most importantly, it's looking at like the white breads, the white pastas, the white rice, as well as juices, sodas, anything that's really going to spike that insulin, that IGF-1, and that IGF-1 is then going to lead to sebum production. It's going to boost testosterone, and it's going to really just take that acne from being something small to something potentially large with cysts and other things.
We started off talking about our Italian background, and to be honest, I mean, a lot of my patients will be like, but I'm Italian. Of course I'm going to have bread and pasta. So how do you respond to that?
Yeah, I had the same issue, right? Because my favorite meal was pasta with cheese on top. And those are the two things I couldn't have. So I found in time that I could eat it, but it's all about moderation. And I think for a time, I couldn't eat it at all. And then in time, I got to really, I guess, enjoy it and appreciate the fact that this is a treat and this isn't something I should be having every day. There's different types of pastas. I mean, I've definitely went through the ringer trying the chickpea pastas and some of them that aren't that great.
What's wrong with chickpea pasta?
Oh, it's mush.
Oh, you overcook it. You got to eat it half uncooked.
Still so bad.
It's got to be still hard from the pack.
I like the bean pastas I find aren't bad, or the lentil pastas are okay. And I found the alternative of like brown rice noodles. So if it wasn't pasta, then I kind of went Asian with it, and I tried some like different noodle dishes, and that was good.
Yeah.
Nutritional yeast instead of cheese. I don't mind either. So you really have to play with it. Like, I think it took me time to figure out what I liked, what I didn't, and it was a whole trial and error basis. So hopefully me having gone through it myself, I have an idea with patients, okay, I know that this may not be up your alley. This is probably good to try. And
you have firsthand experience with these alternatives.
Yeah, exactly.
That gives people confidence. It's like, well, your skin looks great and you're vouching for it. I'll try it. I guess it's a good way to kind of win over their expectations, and they don't feel like it's such a big sacrifice, because it's not. Back in the day, we used to like say like you have to cut it out. Now we can say, well, there's an alternative. It may not be like your favorite starting today, but maybe in time you'll notice that it's like, actually, you know, it's actually not bad, and I feel better after I have it, and my acne's better. Yeah,
I agree.
What do you see, or how do you differentiate like a childhood acne, teenage acne, young adult acne? Are they different? Are they the same?
I think they're different in that you're going to have different expectations with each. So if a patient's a teenager and they're having acne, it's the case that almost 3/4 of the teenage public have acne. So it's something that's expected, and it may not necessarily last into adulthood. Whereas if someone didn't have acne throughout their teens and then it's coming on as an adult onset, it might be a little bit more difficult to treat. And we're looking at probably different treatments. Children, I find in general, bounce back quite quickly. So it's not something usually that lasts very long, which is great for them.
Usually, would you say it's dietary for the childhood acne?
Yeah, I think diet plays a big role in childhood skin disorders in general, including eczema.
Yeah, very much so. I mean, I'm an anti-dairy guy.
Yeah, okay.
So especially when it comes to eczema and like atopic conditions, I'm like, listen, there's a triad. There's the lungs, the large intestine, and the skin, and they are feeding off each other.
100%.
When you start learning about that and how they interconnect, and it's like, oh, that makes sense. The ear infections and the asthma and then the eczema came in after. I'm like, you start seeing how this dairy thing kind of infiltrated and mucked up the system.
Yeah.
Specifically for, let's look at like hormonal related acne. And usually it's like around the chin here. I typically say that it's like estrogen dominance. Would you agree? And what would you do with that?
I think there's a lot back and forth in terms of estrogen dominance and testosterone dominance. I know there's a lot of tests like the Dutch test that look at different metabolites. I agree that I don't know that we know entirely what it is, because you can take someone's blood, right, and do a serum test, and their hormones in their blood can look perfectly normal, but you're looking at what's locally happening on the skin in terms of the androgen sensitivity, and that's not something that we can really test for. So I think there's something to be said for addressing the testosterone through things like zinc, and also addressing the estrogen through things like DIM.
Yes.
I think DIM is something that's not talked enough about.
Sure.
And it took me a while to even find out that it existed. And I'm like, I don't know why people aren't been talking about this sooner.
Was like I3C sort of like more front and center for that purpose?
Yes. And I think now DIM's kind of coming in, and now they're creating products with it, which I think is great.
What if someone said, well, I'll just eat a lot of broccoli?
I would say you're going to have to eat a lot of broccoli. And even start now. And I'd say you probably aren't going to see, I wouldn't say you're going to see the best results, because you're looking at something that's been, crafted in a lab with a certain potency, making sure you have those active ingredients. Not to say that you're not going to get a lot of benefits from the broccoli, but why not do the broccoli and the DIM?
Yeah.
If they're open to that.
Yeah, you would get the nutritional, functional food, but the benefits of like a scientifically studied micronutrient.
Why not? Yeah.
Yeah. So someone comes into your office and they got like cystic acne. They're quite inflamed. They're visibly kind of uncomfortable. And they're like, listen, like, where do I get started? What would you do? What would be your first few steps?
I think my first few steps would be doing a physical exam, because I want to know, do you have PCOS? Like, is there another reason why we're seeing this, or is it just acne?
Do you find that you can have a little bit of both? Like, I'm kind of on the spectrum of PCOS. So I got elements of it.
Yes. And I think PCOS is actually, it's a syndrome. And I think that diagnosis is being given out a lot, which kind of makes it hard to navigate. But I think it's something good to keep in the back of your mind, because there's always myo-inositol actually is like a treatment as well. I was reading a Medscape article the other week, and they were saying doctors have thought of this new supplement that's the best supplement they should be giving for acne outside of medications. And I had to scroll and find out what it was. And it was myo-inositol. Even though most of the research is done in PCOS, they're saying give it to any female patient with hormonal acne.
How about male?
How about what?
How about males?
Males. Oh, yeah. I don't know why they said females. I guess because the research has been done in females, but I don't see why you couldn't do it in males.
It's an automatic bias, because inositol is used for PCOS.
True.
And it's like, what if a man, like, so I just tell people it's for dysglycemia, it's blood sugar issue, as opposed to, because really that's what it's treating in the PCOS.
You're right. There's nothing that says it can only
the label.
Yes,
it's
exactly.
Like for PCOS, like for females with ovarian syndrome. Because I've at least 5 or 6 times I've gotten a call from a somewhat perturbed male after I recommended it, and they took it home and they start reading and they're like Googling, and I'm like, what did you give me? Like, you gave me something for women. I'm like, no, it's not. It's for everyone.
It's the labeling. It's the same thing with Rogaine, where like if that's recommended to a female, they're looking at it and there's a man with a beard on it, and they're like, what are you talking about? I have to use this. This isn't for women. But no,
now, if they use Rogaine on their face, would it grow a beard potentially?
If you're using Rogaine on the face?
Yeah.
Yeah. I assume it might grow in areas that it's not supposed to grow.
So I mean that one might be an example where there's somewhat valid. Just like I'll be like, careful.
Yeah. Oh yeah. Don't put it on your face. There's even lash.
Like, I noticed that.
Put it over here. Why not?
I thought it was good for like moisturizing.
Yeah. There's even been like lash serums for growing lashes where I've seen, obviously it might get around the eye, and I've seen videos and pictures of people who have hair growth now underneath their eyes and on their cheekbones.
Yeah.
So possible hair can grow in lots of different places.
There is follicles here. I mean, I've seen men with like very coarse beards, and it looks like it's starting like it looks like it's a unibrow leading into sideburns.
Yeah.
And like I think that just talks to like there's genetic dispositions, there's familial stuff. Like it's like my parents are like, they'll say, "Oh, I had acne, you had acne, you got hairy arms, I had hairy arms." There's some things that are like passed on, but you find that most of these things can be compensated for through supplementation and diet.
I think there's definitely like the option for.
Dang, that's a loud dishwasher.
I don't know if it's gonna pick it up.
I think I'm gonna just mute it or stop it for now. It was fine until.
It was pretty quiet until this last little rinse cycle.
Oh, that's what it was. Give it a break. I'll run it again after. I bet there's like 3 cups in there.
What were we talking about?
I said something about like passing it on the genes and like hairy arms and acne.
Oh, yeah. I think there's definitely ways to compensate for genetically predisposed acne. I don't think that should hold you back from trying different things or trying to address it. Especially with acne because it's so multifaceted. I think genetics is only part of it.
Sure.
And yeah, I don't think it should hold you back from trying different things.
Before you mentioned like chocolate, and my experience with acne is like I noticed in high school was getting bad, and I'm like every time I have chocolate chip cookies or some junk food that has chocolate, I break out. So like for a year and a half, completely zero chocolate, and then it completely cleared up. It was very good.
Nice.
But then over time, you start hearing and studying, and like things would pique my interest and be like chocolate. It's like, obviously that's not true. That's a wives' tale, or that's been debunked. But then you mentioned that, and it's like, but I know firsthand that was a big trigger for me. I'm wondering about like the state of the art where it is now. Like, is that like more globally accepted that like, yeah, things like chocolate can be an obvious trigger for acne?
I think it's widely accepted. I think people have an idea, especially with like junk food, processed foods, chips. I think people are getting more and more knowledge from social media, from online, and some of it's great and it gives them tools to change their diet and hopefully clear their skin. But there's a lot of people who still think like I said, like dark chocolate, if I have a better version of it, if I have an organic potato chip, that, it's not going to break me out. When it's like, there's some things we can play with, and there's other things that are just a hard no, and you might just not be able to have it. And of course there's different people that have unique triggers, and other people have the cleanest diet I've ever seen in my life and they're still getting acne. So there's something to be said for diet for sure in most people, but everyone's different.
So when we can isolate the diet and say we can make significant change there, and they're still breaking out, is stress like one of the factors that we have to like say like, okay, no, but seriously, there's something going on here?
Yeah, I think questioning and kind of finding out when the breakouts happen. I mean, some people have it continuously throughout the month. Other people will say before my period, I get it. Others will say, right around exam period, I get it. Okay, well, that gives me clues. Maybe it's the stress. Do you have anxiety? Have you ever been screened for anxiety? Low mood, like, are you getting outside? Do you exercise is another big question. Because without, the blood pumping, you moving around, opening those pores and sweating, things aren't exiting the body as they should.
Sure. A lot of people, and that's a good point, because I've mentioned that, and they'll be like, listen, as soon as I start exercising, I find it breaks out more initially.
Yep.
Do you find that sometimes there's some things that are like you're on the right path, but it gets a little bit worse before it gets better?
For sure.
Yeah.
I think a lot of the times, especially you see that with medications too, that things get worse before they get better. With exercise, I see that potentially being an issue at first because, again, blood flow is moving to the skin, which could already be red and irritated.
Sure.
And you're moving you're potentially opening pores that are already clogged. So you're trying to move things, and in the process, it might be worse before it gets better.
Okay.
So I think that's something also to warn patients of going into treatment, saying that we don't know exactly how this is going to work. Long term, we've seen the studies and I have experience with it, but everyone's different. So be prepared.
Okay. So you kind of have to have like a hard line with patients and have a conversation outlining like, this is not a 3-week crash course and like you're going to come back and
wish it was.
No. Are we looking realistically at, was it 3 months, 6 months?
I would say it depends on the level of severity, but at least 3 months.
Yeah.
And if we're talking cystic acne that you've had for years, we're looking at more like 6 months. Not to say that we're not going to see improvement over that period of time. We should after at least a month or two. But definitely I think documenting it is a good idea too. Sure. Obviously for our purposes, but also for the patient's purposes, because for someone who, you know, has acne and probably looks at their skin every single day, maybe like pops and counts how many pimples they have, they may not actually see things getting better because they're so hyper focused on the things that are going wrong with their skin.
Sure.
Or that are still remaining on their skin. So I think it's a good thing to bring up in appointments, like look at the progress you've made. Even if you don't see it, we have tangible evidence that this is improving, this is working.
When you say tangible, what does that mean? Like taking pictures?
Yeah.
Is that something you do?
Yeah.
Okay.
Yeah. I know some dermatologists do like lesion counts, which is great, but then there are certain patients who have what could be 20, 30, 40 pimples at a time, especially if it's all over the back, on the chest. And then are you really counting? You know what I mean? Once it gets to a certain number, I think it's easier just to take pictures.
Sure.
Yeah. If
because
patients up into
there's a gross like anatomical assessment you could do. Be like overall, be like, yeah, it looks better. I didn't count, but like we way less redness, less papules, less whatever.
Yeah.
Okay. Now, what are some things that people can do? Like, well, do you recommend like a hygiene routine? Is there certain ointments, certain creams, like in a general idea?
Believe it or not, I think I actually stray patients away from a lot of natural topicals. Believe it or not, like the face washes. I've actually done some research and talked to some cosmetic formulators.
Yes.
That work with natural ingredients. So I'm talking like different plants and herbs. And there's a lot of things that the public doesn't know about when it comes to natural products. They sometimes think that because it's natural, it's better. But like, for instance, they were talking about how plants often, I mean, there's different growing seasons, right? So the vitamins and the minerals that you think you're getting from a plant, if it was plucked during January versus August, you're going to be getting different things in your product. It's not all standardized like it would with a man-made ingredient.
Interesting.
And then we're also looking at preservatives, right? So you're probably going to need more preservatives to actually like encapsulate a herb versus a man-made ingredient again, which a lot of those preservatives can cause problems for a lot of people too.
Wow. Okay.
Yeah.
So sometimes they're better off with less.
Yeah, often better with less. I think over exfoliating, using too many products at once can actually cause more harm than good. I think having a few good products and not changing them around all the time may be better than not. And I think seeing actually an esthetician is something that more people need to do rather than trialing out with different things that they've seen online or that they've heard from a beauty clerk, or you know what I mean?
What would the esthetician be offering?
I think they'd be offering, they have quite different cool machines that can see like hydration level of your skin. Often they probably have the experience of seeing a lot of different product lines and different patients.
Okay.
So I think that would be something to think about, as well as talking to a dermatologist. I think I see a lot of patients that haven't seen a dermatologist and they're seeing me for the first time, which is fine. But I think it's great to have a professional opinion, another professional opinion. And a prescription grade topical could actually do the world of a difference.
Sure.
Rather than starting low and then, I mean, you can start low and work your way up. But if you've been trying so many different things and it's not working, then maybe we have to think about oral treatments.
Sure.
Or something that you can't get over the counter.
Yeah.
Necessarily.
So that goes back to the idea of like, let's start with something medicated, at least topically, give you some relief. And then the naturopathic stuff is kind of bringing you to a point where it's like, we put out the fire that's causing all of this. Now you have clear skin to keep.
Yep.
There was a couple of things I wanted to ask you. What's your thoughts on Accutane?
I've been on Accutane actually.
Yes. So I guess part of you likes it.
Yeah, you know what?
Or
Yes
used it
and
at least.
no. Yeah, yes and no. I think it took a lot of time. I think Accutane should never be someone's first option, even with severe acne. I think you should give it a trial of trying different things and other medications or other naturopathic things before you go on Accutane.
Okay.
Mainly because I think there's a lot of things people don't know about taking it.
What would be that? Like, what's the liver damage?
Yeah, so liver damage. So you do need to get blood work every single month that you're on Accutane. Some say, oh, you'll only be on it for 2 months. You can be on it up to 6 months. So that's something to keep in mind. If you have had suicidal thoughts or suicidal ideologies in the past, you will have to sign different forms and have to see like a psychiatrist or a psychologist or a therapist while you're on treatment because of disinhibition.
Oh, okay.
Which is something that, again, I didn't know about. And you also need to have 2 forms of birth control at all times.
Yeah.
So for women who are like thinking about conceiving, Accutane
Okay.
out of the option. Yeah. And even once you get off of it, you need to wait a certain time before you even think about getting pregnant. So there's
like a half-life, 3 to 6 months at least.
At least 3 to 6 months. I would say 6 months.
Yeah.
The longer,
Just
the better
safe.
that you can wait.
Okay.
So there's that. The dryness, of course. I think that's something everyone knows about. But also that your acne can come back.
Right. Okay.
I think people think it's, a cure-all, which in some people it is. That's what's nice about it. In some people, the acne never comes back. Whereas, some of the antibiotics or spironolactone, your acne will come back. With Accutane, not always. But we're seeing more and more, like up to 38% of people are still having acne afterwards. It's clear for a bit, and then it creeps back in.
What do you think is happening there?
I think the root cause of the acne is just not being addressed. I think that people haven't been screened properly, or you're targeting the wrong thing. Like, yes, Accutane will completely dry you out, but, why are you producing oil in the first place? Or like is something hormonal going on? If you're still stressed, if you're still not sleeping, all these other factors, or if you're still not eating great, then things are going to come back.
Sure.
And I don't think that conversation is had enough in the dermatologist's office. Everyone's different. Don't get me wrong. Maybe some people did. But there's long-term consequences for sure.
Yeah. Now, someone with acne scarring, what do you recommend for them?
Vitamin C.
Yes.
Vitamin C is great. I think sunscreen is pivotal. So just preventing further, pigmentation. I think silicone actually works really great. There's different formulations, but
how's that? Like as a
it's just like a gel.
Yeah.
Yeah, that you can just apply topically.
And so is that you have to reapply?
So you can use it at night. So you can use one little pea-sized amount and just apply it to the spots that have scarring. And it works really, really great. So it's been used like with stitching. Like I used it on a patient post-mastectomy who had really bad scarring.
Sure.
But you can also use it on the face. You can use it all over the body. Obviously,
so any type of scarring.
Yeah. And I would say it works very, very well.
And it's like a permanent improvement?
So it'll lighten the scar and
the depth of it.
So in terms of ice pick scars, that's a whole other thing to address. That you're probably looking at maybe microneedling, something that's gonna force collagen to be produced and kind of fill in those spaces. Or you go to your dermatologist and they have different fillers and saline solutions that they can inject to actually just cosmetically make the skin look smoother.
Yeah.
And then in time, you probably have to keep getting it filled depending on how big the actual pit of scarring is.
Sure.
But I think microneedling, if it's very surface level, is a very good option.
Okay.
Yeah.
How about red light?
Red light's another great option. Yeah.
You know, I always try to mention red light. It's
Throw that
my
in
new
there.
toy.
Yeah, because it boosts collagen production as well, right?
It does.
And it reduces inflammation. So that's another option even for acne. And it's great because you just kind of sit there, right?
Passive.
Exactly.
Simple.
Simple, easy. And especially people who have like at home machines, it's like you don't even need to go out. Or if you have somewhere nearby that you can just pop in on your lunch break, you know what I mean, at the end of the workday.
Yeah.
Why not?
Yeah. I think everyone's going to have these red lights eventually. It's just going to be like a fan on your desk.
Yeah. Part of your just,
And you know, it'd be great if we can manufacture something that's like, it's got like full spectrum light, different wavelengths. Actually, I have a biopterin light with different lenses, different colors.
Cool.
Yeah.
Because I think, I mean, red light's great. There's also blue light, which especially for acne is really great.
That's interesting. So I have that too.
Yeah, that's the next big purchase.
No, I have it already. I got
it. You do? Oh, great. I think blue light's particularly great for acne. I think red light, even maybe once the acne's been cleared, you want to work on the scarring and the brightness.
Okay. So the blue kind of offsets the like what you have envisioning the red inflammatory state, kind of like neutralize it, I suppose, and then afterwards the post recovery is more red light induced.
And I think you really can do both. I mean, both are for acne. Blue light specifically kills the actual like P. acnes bacteria.
Wow.
So, so I think that's definitely an option. And I mean, whatever works for people, right? It's great.
It's no harm in trying.
Exactly. And it gives an option. Also, I think what's not talked about enough is pregnancy and acne.
Okay.
Because there's not a lot of options when it comes to, let's say, the medications.
Sure.
A lot of them medications are teratogens, or they play with hormones like spironolactone, which doesn't really give much of an option. And even the topical vitamin A's like the retinols, you really can't be using in pregnancy either.
Sure.
So I think naturopathic practice comes in really great there because we have those options that are not medicated and that are safe during pregnancy.
That's good. That's good to know. That's a good point. Anything else? Because it's a big topic, but we had like a little crash course into it.
Yeah. Nothing else. I think it's just important to seek professional assistance. I think time and time again, people spend a lot of money and a lot of time trying to fix their acne at home when things often just get worse, or they can get worse. And then you're dealing with things that are harder to treat and also scarring that's going to be harder to reverse.
Sure.
So I think really addressing it as soon as it comes is pivotal. For sure.
Okay.
Yeah.
All right. This is great.
Great.
Thank you, Dr. Angelica.
Anytime.
We'll do this again. Other topics. You're a wealth of knowledge.
Thank you. Thanks.